Hey, hi everyone. I'm just gonna wait for a few people to jump on before I call Dr. Nassif in. It's Carrie from TSC. So we've done something really super exciting. We are going to do an Ask the Doctor segment. So you get a chance to ask plastic surgeon, renowned plastic surgeon, Dr. Paul Nassif from Botched, and you get to ask him questions that you want to know about. And thank you. You're already starting to write in. Thank you so much for joining, everyone. And I've got two giveaways as well. So we're going to give away a $50 TSC gift card because Dr. Nassif is going to be joining us on the network on Sunday. So we've got some really great blockbusters and fabulous buys. So maybe you could spend the big $50 there. So that'd be kind of fun. And then we're also giving away one of his blockbuster buys. So just comment in the section, ask questions, and find out what it takes not to get botched, right? Let's see if I'm going to call him in. And so, hi, everyone's waving. Hang on a sec. Let's see if Dr. Nassif's ready. Here we go. Let's turn up some volume. Hopefully we can get this going, Dr. Nassif. We're inviting him in. He'll just be another moment. But this is what we have been waiting to be able to share with you now for a while, because I know so many of you have written in questions and of course, all over social, but it's a great opportunity to really understand, a facelift. How long does it last? What do you need to do to prepare? I mean, all these great things. Hang on, let me see if I can invite him in again. Let's see. Let's see. Hi, Kathy. Hi, Anna. Hi, everyone. Oh, Dr. Nassif is unable to join. Okay, hang on. He'll be with us soon. Dr. Nassif, if you can hear me, I'm going to try to ask you again to do the invite, and we'll get you. Not to worry. He's as tech savvy as I am. There we go. How's that? All right. Well, I guess we'll find out. Okay. So, in a few moments, hopefully he won't be long. I want to make sure you're entered in to win. So comment, wave, say hello, ask a question so I can give away this $50 gift card. Dr. Nassif, let's see one more time if I can get him. There we go. Invite. Hey, Dr. Nassif, are you there? Hang on. This is working out well, isn't it? Oh my gosh. Okay, we'll get him. We'll get him, guys. I'm so glad that everybody's tuned in to join us today to Ask the Doctor segment. All right, Dr. Nassif, go ahead, try again. See if we can get you. I know you can do it. Hey!
I've been here waiting, but you haven't hit the...
I hit the button. I hit the button. All right. We got you. That's all that matters. We're only a minute or two. How are you, my friend?
Hi, Carrie. Thank God everything's excellent. I just got home from surgery. Just saw the baby.
Oh.
And now I'm here, sitting here. Actually, boy, your camera is so much better than mine. I'm wondering here if I clean it up a little bit. But
hey, it's the magic of lights. Magic of lights.
I'm ready to have some fun.
Good. We've got, we had a lot of people sending in questions. This is an enormous topic, as you obviously know. And I mean, it's your hit series on Botched. I mean, what are you at, 8 seasons now?
Well, we just finished season 7.
Season 7, going into 8.
So now we'll have to see about season 8.
Yeah. Yeah.
You know.
I mean, this we launched together 2020 just
Yes.
as the pandemic hit
Hmm.
at TSC. You did have a plane ticket to come to Canada and
Yes.
then
Yeah. I was at HSN about to leave the next morning, and then we got an email saying, "Hey, bye bye, don't come out." And that's when you guys shut down, and then we shut down. I think pretty close after that.
yeah.
So it's been a couple years already.
Yeah, it's been a bit crazy. So
Yeah.
I'm hoping you can get back here to Canada and get yourself, because you have such a big Canadian following, and I know a lot of Canadians are coming up to your to your clinic, right? To
Oh
your
yeah,
office.
we have a lot of Canadians all the time.
Yeah.
I probably do maybe about 5 Zooms a week from all over, especially Ontario. That encompasses a large part of Canada, right?
Yeah. Of
That's
course.
part of
Well, center,
Toronto. Yes, sorry,
Toronto, it's big
Toronto's in
population.
there. Yes.
Yeah, big population. Okay, let's get started. People want to know, first of all, how to avoid getting botched. How do you pick a surgeon? What do you do? Take us through the 101 on that.
Well, obviously, one of the best ways, if you have a close family friend, a referral from a doctor about someone that.
I just lost your volume. Try. There
Oh,
we go.
can you hear me?
Got you now.
Uh,
Yeah.
Someone, let me put it on mute. Someone was trying to call in, and I put on airplane mode, but it still came through. Anyway, if you know someone who's had a procedure
Listen,
by,
this is a first for you and me.
no, I've done plenty of these darn things. Anyway, but most
Yeah.
importantly, you want to make sure you find a board certified, plastic surgeon, facial plastic surgeon that specializes in that procedure. So you could be board certified, which is a good start, but you want to make sure they have a lot of experience. Let's say you want to have liposuction. There's many good doctors
Yeah.
that do liposuction, but what you want to do is to make sure that that person, basically, it's in that doctor's wheelhouse, does it all the time. You do want to look at reviews. Why not? You want to look at before and afters. You want to go to the office and see how everything flows. Does everything seem professional? And then, of course, you want to listen to the doctor and basically, okay, does it make sense? Because right now, many patients are very educated. And does
Mm-hmm.
it seem like, okay, that makes sense what the doctor wants to do? You can even go to the extreme and kind of look up to see if the doctor has lawsuits. If so, what type of lawsuits? Does the doctor have privileges to do that procedure in a hospital? There are so many things to ask. And I will tell you, for example, if you have a relative or friend that had, let's say, that lipo or a breast aug or a rhinoplasty
Yep.
from someone that is actually excellent at what that doctor does, and then you do all the other research, then you go and have the consult. You have to
Right.
put it all together.
Yeah, and I mean, you need to shop it, I think, don't you? Like you really do. Like, would you suggest interviewing more than one surgeon?
It depends on if you're going to someone, I mean, usually 3 in general.
Okay.
But if you're going to someone that actually um, focuses and is pretty internationally known for something, then you don't have to go anywhere else.
Right, right. Well,
So,
we thank everyone for joining us, and we've got Panama, Mexico. Hi, my family always watches your program. I mean, you've got tons of fans, obviously. Thank you. Write your comments and questions there. What would you? Oh, hi from Australia. Botched from Brazil. So around the world. Listen, when we talk about some of the most requested procedures, where do we go? Like, I mean, is it the eye area? What is it?
well, since I'm a facial plastic surgeon, the number one aging face surgery is the eyes, first of all,
Yeah.
and especially the upper eyes. In an upper blepharoplasty, when you're removing some skin on the upper eyelid. But again, for the lower eyelid, you have to be very careful, because if the doctor speaks to you about removing skin from the lower eyelid, that's a very dangerous thing to do. I can't recall the last time I removed skin from the lower eyelid. There are things you can do, but you have to be very careful. We treat the fat. We even do fat grafting. We use lasers. We use different things. But you have to be very careful of what you do with the lower eyelid, because,
Mhm.
again, you can heal, not in the best way. You can heal with the eye pulling down like this. And we had one of those on our show not too long ago. So you
So,
have to be very careful.
yeah, talk about the show. I mean, with the, people always sort of want to know is there something, a moment that sticks out? And I mean, obviously you've had so many, but is there that transformation that just blew you away?
Well, I think in one of the seasons, it might have been season 3, there was a patient that had a unique symptom of fluid coming out of one side of the nose.
Mm.
And when you hear that, you think of something not good. You think of fluid coming from the brain dripping into your nose. And we did I think I did a MRI or a CT scan, I can't really recall at that point. And we basically found out that the patient had a bunch of what we call aneurysms.
Yeah.
These are little, on the blood vessels, these little out pockets of thinning tissue. And if that pops, one of those pops to a blood vessel in your brain, you're pretty much say goodnight. You're gone. And I hate saying that, but luckily we found it. We diagnosed it. She had it fixed. And then I ended up doing her nose. And so it was like really a double win. Saved her life, saved her nose.
I watched that episode. I was in tears. That how you talked about how that related to your own life and your mother, and it was just so lovely and emotional and warming. And
Yeah.
because we often talk about and watch in the show. And don't worry, guys, I'll give away the gift card, and also we've also got the Blockbuster package to give
Oh,
away.
that's right. Blockbuster
Um,
package.
yeah, and we'll
Yeah,
talk about that because your visit's coming up on
I
Sunday.
know. And
But
that was the show, by the way, I fell apart, right?
yeah.
Yeah, I was bawling.
It was so wonderful to see
Yeah.
that side of you. I mean, it was so real and wonderful.
Yeah.
Uh, what I wanted to talk just a moment about is the unreal expectations that that people have, when they come and see you. How do you feel about that?
Well, it's routine for me, um, because sometimes a lot of patients think that I can perform miracles, and we can't. No matter how good of a job I do, there's still always risks. There's still complications that can occur. And one of the things that we always try to do with patients as we sit down is try to get them to have realistic expectations.
Yeah.
And sometimes I think I do, but then after surgery, we don't. They're gone. They're unrealistic. And then it causes a conflict and the patient's not happy. So one thing I sit down with the patient and explain what you're asking is way too much. And you see me, I give tough love. I will say I do.
Oh yeah.
And that's but I do it on purpose. And I get upset sometimes, because of what patients do to hurt themselves.
Mhm.
But with the tough love, it's basically, listen, here's all you're going to get. You're going to get an improvement here. You're going to get this improved maybe 50%, this improved maybe 75%.
Yeah.
Not much more than that. Would you be happy? Most of the time, they're going to say yes. But then maybe they do get that 70% improvement in that one area. They may not be happy because that's again with expectations. You told them, but maybe they forgot about it. So it's a difficult thing to deal with patients with unrealistic expectations. It makes what I do extremely, extremely hard. Because then what happens is they get upset. And you have an upset, unhappy patient.
Mhm.
No one wants that.
It's so wonderful to watch that process through the show Botched, and we thank you
Mhm.
so much for that. And then you come out with this skincare, and I'm going to give this $50 gift card. I'm going to give this to Debbie, and I will get in touch with you, Debbie, because Debbie asked this question. I just turned 70.
Debbie. Yeah.
Debbie, I just asked. I just turned 70. What products can I keep my skin looking good without having surgery?
This is, hold on, I'm going to show you something. And you already know the answer to that, which, because you and I have done this so many times, but hold on. Let's see. Let me see if I can quickly just turn this. Okay, you ready? Paulina, do you want to say hi to Canada?
Paulina.
Say hi.
Hi, sweet girl.
Wait, where are you going? Paulina, say hi. Watch. Hold on, I got to do this one thing. Hold on, Here, let me just do this. Here, Paulina. Say hi.
Hey, Paulina.
Say hi.
Hi, everyone.
Way more? Say hi.
Hi, sweetie pie.
Love
Mwah, throw kisses. Mwah. Oh, you've been
you.
so wonderful sharing that and sharing your family life and just watching her. You know, we went through that pregnancy with you here in Toronto, you know, in Canada on the network.
Right.
Yeah, we did. So it was so wonderful. That's so sweet. What a great moment. You know, when Debbie writes in, you know, something like that, because you are a renowned reconstructive facial plastic surgeon, yes, board certified, creating all these techniques, lecturing, you really went back to the foundation of it all and said, listen, we got to get some great skin going here. And these are products that you developed.
Absolutely. I mean, one thing, you know, it takes 3 years to make a product. And for Debbie, you know, so Debbie, we're going to be on, let's see, Sunday all day.
Sunday. Yeah.
Sunday. And I want you to actually watch, and right now our blockbuster, what is it called? The blockbuster special, or
the complexion perfecting duo.
So
right
you
here.
have your detox pads, which is my, you know, basically the one and done 10, 11 different features to your skin benefits with one detox pad. And that's the new hydrogel, which basically does so many things. It's actually an exfoliant, it's a hydrator, and also has retinol. It's actually got retinol bound to hyaluronic acid, and the salicylic acid, which is also going to help just gently exfoliate. So you do these two products, that will be your first way to start. And you saw Carrie, and by the way, that's a delivery system. You just depress that cap inside the bottle, and then that will actually aspirate it up, and then you push it when you have it go to your skin and deliver it on your skin.
Beautiful.
And both of these products contain salicylic acid. And in the someone just asked that. And by the way, hi South America, hi Europe, hi Australia. Everyone's out there. I see that, the UAE. But what's important to understand is that there's different types of salicylic acid. The salicylic acid in the detox pads is different than the one in the hydrogel. It's called Ami Perfect ER. It's salicylic acid in the form of a wintergreen extract. It's gentle for exfoliation.
Mm-hmm.
So that's in that product.
We also, I'm going to do a quick question here because I know your time is tight here. And I want to give away the blockbuster that you just talked about. Ty Franco, I'm going to give it to you. We'll be in touch with you. Ty Franco. What's good to tighten your neck? That's the question.
So
surgical and non-surgical. Maybe you can do that for us.
So I do what I call I do a deep plane neck lift. Sometimes you have to combine that with the facelift to do that exactly. You're actually taking the platysmal muscle and pulling in this direction, but then you're taking the face from here and you're lifting up here. So you're going here and here, and again, you won't go where your goal is. You want to be very natural, and that's a deep plane face and neck lift. You can do a short scar, you can do a mini, you can do all those. Sometimes if the neck is still tight enough, you can just make an incision here and tighten up the muscles.
Oh.
There's also a lot of radio frequency and ultrasound devices in the doctor's offices for neck tightening. For the wrinkles, texture, tone, a little bit of lifting. You got to use our Deco Lift.
The Deco Lift. It is.
Yeah.
It's terrific. I'm going to tell you. Okay. Dr. Nassif's going to be on the network here Sunday. And I know you've been asking, where can I get these products? You can get them here at TSC. We are exclusive with Dr. Nassif in Canada. Super exciting to offer it. And whenever it comes in, sells out. You know, Doctor, when you launched with us, March 2020,
oh boy.
You had more 5-star reviews in a single launch of a beauty product that I've seen on any product line. And you know that because you see those reviews.
You know, I love hearing that. I mean, one thing that's really, you know, our goal is to keep everything sustainable so that you're going to like it and love it. I mean, one thing, listen, yes, and somebody just said use a Deco Lift, doesn't work, works beautifully. I use it twice a day. So, you know, one of the things is I'm actually getting ready because I'm going to go talk to Australia in about 10 minutes.
Okay.
Or 9 minutes. I think you know about that. We're doing some Australian skincare stuff, TV shopping, but I'm just grabbing my shoes in here. But to answer your question, you know, products, listen, people will buy my product because they've seen me before. But the point is, if they don't like it, if it's not a great product, you're not going to buy it again. That's it. And the point is, and you know, it's like when you go to a restaurant too. Let's say you go to a restaurant and you have a bad meal. You tell everybody.
You're not
you
going
tell
back.
everybody you reviews.
No kidding.
But usually when you have a great meal, usually you don't do anything. But for us, when we get these incredible 5-star reviews, and I want to thank all of you for doing that, we love that. Because it really tells them, it's a testament to all the TLC with the chemists that we put together, all this, you know, all the time of getting you the best products. And for example, when we were with Carrie, and Carrie mentioned, as a matter of fact, I was in Boca Raton, Florida, when we did our first, little hit in March.
Yeah.
Before I flew to Home Shopping Network, and I went there for a few days to do my stuff there, and then boom, it got canceled. But you and I did our first sale, I think on a Zoom or Skype, whatever it was.
Yeah.
When I was in Florida.
It was great. It was great.
Yeah.
Listen, I know you got to go. You got to be on Australian TV shortly, in a matter of minutes. Okay, final last question, and thank you everybody from around the world for joining us. How long, people want to know, how long does an eye lift last? How long does a facelift last? Then we'll let you go.
Okay, so no matter what, when it comes to a face, you know, you're on a conveyor belt still aging. I pick you up and move you over here, but then you're still aging. So the point is, let's say I do it at the age of 50, and God willing, I make you look 35. So now when you're 60, hopefully you'll look 45. So in other words, you're going to keep aging, but hopefully you're going to age at least 10, 15 years younger than if you didn't do anything with your face. Now, a lot of patients, depending on the elasticity of the skin, 7 years average, maybe 10 years. That's kind of the average for the face. And, you know, again, we're doing a deep plane, which involves elevating underneath the tissue. You're getting upper cheek, jawline, and neck. For the eyes can actually last about a good 15 years.
Great investment. Great investment. Okay, TSC on Sunday. This is the big blockbuster, the detox pads, as well as that hyaluronic. So that's there. You've got your Hydra screen, which is always so popular. And I know we could just sit and do this for hours and hours. I know we got off to a bit of a bumpy start there for a second, but I hope we get a chance to really do this because it helps everyone, and you can see the impact around the world. So, you know, everyone's fascinated and they love you as I do. So more botched and more TSC shopping. So I'll see you soon, okay?
Carrie, I will see you. And everyone, thank you for tuning in to this a great little Instagram live. And we'll see you all in Canada this weekend on Sunday. We have a bunch of shows.
Okay. Mwah.
Bye, Annie. Thank you. Bye, Carrie.
Thanks. Bye-bye.